Welcome to Understanding Diabetes. As a staff member of an SRS, you can play an important role in supporting residents to manage their diabetes. By the end of this video, you should have an understanding of high and low blood glucose levels, how to help residents prevent complications, and some tips and resources to help you in your role as an SRS staff member. Now, we'll do a quick overview of the main types of diabetes you might encounter in your role as SRS staff. Type 1 diabetes and Type 2 diabetes. So to begin, what is the difference between the two types and why is this important? In Type 1 diabetes, the body is unable to produce any insulin, while in Type 2 diabetes, either there isn't enough insulin or it isn't working properly. Since insulin's role is to help move glucose from the blood into your muscles, in both cases, instead of being used, glucose builds up in your blood. You may need to communicate this information with other health professionals, such as paramedics in an emergency. So while this may not affect what you do each day, it is important to know that there is a difference between Type 1 and Type 2 diabetes. People with Type 1 diabetes require insulin every day to manage their blood glucose levels. Management of Type 2 diabetes will usually include a combination of diet and lifestyle changes, as well as medication, depending on the stage of the condition. If diabetes is not managed well, blood glucose levels, also known as blood sugar levels, can remain high, increasing the risk of long-term complications. Let's take a closer look at each of the most affected areas, starting with the eyes. Damage to the fine blood vessels behind the eye can result in poor vision, known as retinopathy. An optometrist will monitor the health of the eye and identify any changes early. Annual reviews with the optometrist are recommended for most people with diabetes. The Australian College of Optometry provide outreach services and can conduct sessions at your SRS at no cost. Be sure to encourage and support your residents to attend optometry appointments. If your facility is not linked with an optometrist, be sure to contact the Australian College of Optometry via their website. Other organs affected by long-term complications are the kidneys and the heart. Damage to the tiny filters in the kidneys can reduce kidney function, resulting in a build-up of waste and fluid in the body. Over time, this can lead to kidney failure, requiring dialysis or transplant. In the heart, diabetes can cause narrowing of the blood vessels, increasing the risk of heart disease. Because of this, individuals with diabetes are 4 times more likely to suffer a stroke or heart attack. Diabetes is a progressive disease that varies person to person. While it can't be cured, it can be controlled. So it is important to see your GP regularly to monitor heart and general health. Your local community health nurse can also assist by monitoring blood pressure and providing health education. Another area that can be greatly affected by diabetes is the feet. Damage to the nerves in the feet can result in loss of feeling, while damage to the blood vessels can cause poor circulation. This damage can lead to poor healing, serious infection, and when injuries or infections go unnoticed and untreated, possible amputation. Identifying changes or problems early is important to reduce the risk of serious complications occurring. You can assist your residents by encouraging them to protect their feet from injury by wearing appropriate footwear, inspect their feet every day, and attend regular foot assessments with the podiatrist, usually every 12 months. Exercise is an important part of diabetes management. In addition to the benefits to heart, lung, and mental health, exercise also helps to reduce blood glucose levels and can assist in maintaining levels within the normal range. This will help to decrease the risk of long-term complications. Remember that any activity is good activity, so encourage your residents to be active every day through walking, fitness groups, and other daily activities around your facility. Quick facts. In Australia, 1 new person is diagnosed with diabetes every 5 minutes. 60% of people with type 2 diabetes will develop eye disease within 20 years of diagnosis. 85% of diabetes-related amputations are preventable. Now that we've looked at the complications of diabetes, let's explore blood glucose levels and what the numbers mean. Maintaining blood glucose levels within or as close to the normal range as possible will decrease the risk of long-term complications. Now, how much glucose in your blood is too much or too little? Let's look at the numbers. Normal blood glucose levels for someone with diabetes is between 4 and 7.8. Target ranges vary depending on several factors, such as the individual, the type of diabetes, and the type of treatment. However, general targets include less than 8 before a meal and less than 10 2 hours after starting a meal. Frequent readings above these ranges may require review from a GP, specialist, or diabetes educator. For a complete list of target ranges for each type of diabetes, download the handout Blood Glucose Target Ranges from the Merri Health website. So, what happens when blood glucose levels go too high? Let's take a look. High blood glucose levels are known as hyperglycemia. It can develop over many hours or even days. What would you notice in a resident experiencing hyperglycemia? Well, they may be excessively thirsty, urinating a lot, looking fatigued, or complaining of blurred vision. They may be prone to frequent infections, such as thrush or wound infections, and they may have lost weight without any apparent reason. Many people do not experience the symptoms of hyperglycemia until their blood glucose levels are extremely high. Even though they may not feel unwell, high blood glucose will still cause damage, and the only way to know if levels are too high is to test. So it is important to encourage your residents to test blood glucose levels regularly. Now, there are a few tricky bits about understanding what high glucose readings mean. It isn't as straightforward as it might seem. One tricky bit is that while food and drinks play a large part in blood glucose levels, they aren't the only cause of elevated levels. High blood glucose levels can indicate underlying illness or infection, stress, insufficient medication, or low compliance with medication. Of course, it is normal for blood glucose levels to fluctuate across the day, so the occasional higher reading is not necessarily a problem. It is worth remembering that frequent or unusually high readings, or any readings that are concerning to the resident, need to be followed up with the GP or diabetes educator. Another tricky bit is getting accurate readings. Since there are many things that can lead to inaccurate readings, you can assist your residents to go through 5 simple checks to rule out that option before taking any other actions. So what are these 5? First, check the meter. Is it too hot or too cold? Is the battery low? Check the strips. Are they still in date and are they the correct ones for the machine? Strips that have expired or been stored incorrectly may not measure blood glucose levels accurately. Test strips are not usually interchangeable between machines. Incorrect strips may provide an error message or an inaccurate reading. Check their technique. Are they getting enough blood on the strip and is it in the machine correctly? If this is not the case, the machine may not be able to accurately test the glucose levels. Make sure they've washed their hands thoroughly. Any sweet substance at the testing site, such as juice from handling a piece of fruit, may artificially increase the reading. And finally, is the resident experiencing emotional or physical stress? Stress can increase blood glucose levels, so this may be a contributing factor. For an extensive list of troubleshooting tips, you can download the handout from the Merri Health website. Once they have checked these things, they should retest their blood glucose levels. If the reading is still high or they are concerned, contact their GP or diabetes educator for a review. Now a little exercise to see if you can recall that tricky bit about understanding blood glucose readings. You were talking with a co-worker, Sam. Sam tells you that Jen's sugar readings have been unusually high in the past 2 days. Which one would be your preferred response? Makes sense. She eats cakes every afternoon. Not to worry. Or, That is odd. Better have this checked by the GP. If you chose to have this checked, you got it right. Because it is not usual for Jen to have high readings, she is concerned. It may not just be what Jen has eaten causing her high readings. That's why it should be followed up. Now that we have covered high blood glucose levels, let's have a look at the other end of the scale. Hypoglycemia, or a hypo, is when blood glucose levels go too low, usually below 4. Symptoms of hypoglycemia vary from person to person. However, the common early signs include shaking, trembling or weakness, sweating, hunger, lightheadedness or dizziness, and headache. Other symptoms can include irritability, sleepiness, and mood changes. Symptoms like irritability, sleepiness, and mood changes can also be related to mental health conditions common among SRS residents, so a hypo may not be your first thought when you see a resident displaying this behaviour. Be sure to stop and ask a resident if they could be experiencing a hypo. A hypo can be caused by a number of things, such as delaying or missing a meal, not eating enough carbohydrate, unplanned physical activity or more strenuous exercise than usual, and drinking alcohol, where the risk of a hypo increases the more alcohol you drink. However, the most common cause of a hypo is medication. Let's look at this in more detail. There are many different medications used to manage diabetes, including tablets and insulin. Some of these medications can cause blood glucose levels to drop too low, resulting in a hypo. Most people know that insulin can cause a hypo, but did you know that some tablets can too? Because a hypo can become a medical emergency, it is helpful to know which medications can cause a hypo and which residents might be at risk. Do you know which tablets can cause a hypo? These are some of the most common medications used in Australia that can cause a hypo. Diamicron, Glucovance, Amaryl, and Mini-Diab. This is just a small sample, and there are many other brands available. If you are unsure if a resident is taking a medication that may cause a hypo, be sure to speak with a pharmacist. They can provide you with information about medications and discuss common side effects. Whether a hypo is mild or severe, it always requires intervention. If not treated quickly, a hypo can become a medical emergency, so being able to identify the signs and symptoms is very important. All facilities should have a hypo kit available, which contains clear treatment instructions and glucose options. It should be stored somewhere that is easy to access, and staff should understand how to assist a resident if needed. Identifying residents at risk of hypos is one way to improve awareness and safety. This could be done in a number of ways, including having an individual management plan in the resident's file. This form contains information such as medications and hypo risk. It also contains GP contact details. Now that you have a good understanding of high and low blood glucose levels, let's bring together the range of tools to help you in your role. We've already talked about individual diabetes management plans. This will assist you with identifying residents at risk of a hypo. Each SRS should have a hypo kit which contains instructions for use and several glucose options. Make sure you know where your kit is located at your facility. Blood glucose target ranges. These ranges will help you understand what a resident's blood glucose reading means. You can also use the Special Dietary Requirements list to help you cater appropriately to residents. This list should contain up-to-date information about residents' dietary requirements and should be displayed in the kitchen for all staff to access. Each of these tools can be downloaded from the Merri Health website. That brings us almost to the end of our video on diabetes management. Before we finish, let's see how well you understand your role as an SRS staff member in supporting your residents with diabetes. On the screen, you will see a few sentences. From these sentences, see if you can select the 4 things that you should avoid doing. Good luck! Please contact Merri Health's SRS support program if you have any questions. Thank you for watching this video.